wavering Democrats to vote for the Senate bill, which is what everyone is saying would be necessary, pass the Senate bill first, and then pass a reconciliation bill that would correct and change some of the elements in the Senate bill. You would be asking them, if you asked them to vote for the Senate bill, as it is now, you'd be asking them to vote for the giveaway to Ben Nelson in Nebraska. You'd be asking them to vote for the carve-out on Medicare for Florida, and you'd be asking them to vote on the deal for Mary Landrieu's vote in Louisiana, and every one of those Democrats would face opponents in the upcoming election saying that they voted for all of those things, and their defense, their comeback would have to be, well, I voted for it before I voted against it. How do you convince wavering Democrats that that's a workable proposition?
Well, Lawrence, I don't think that the Democrats are going to see it that way. I mean, I don't want to get into the specifics of the process, but essentially the Senate bill is there, and you're voting on amendments to the Senate bill, and eventually it's the amended bill that goes to the president. So I don't think that my colleagues are going to be thinking much about other than what ultimately goes to the president. And so those provisions would come out. The problem is that a lot of the things that are not money related, such as discriminatory practices, those types of things would not be changeable or be able to dealt with effectively, perhaps, in reconciliation. But I wouldn't worry about, whether it's the Senate bill first or it's get amended. Eventually, what goes to the president would be a bill that the House Democrats would like, and the provisions that you're talking about would be out when they got to the president's desk.
But you all would have had to vote on those provisions and vote in favor of those provisions, and you're going to trust your Republican opponents in the fall simply not to mention that vote you made on the way to the final vote?
Lawrence, your opponent will make up whatever they want, and my own experience is that, they'll say whatever they want, so it doesn't matter. I think the bottom line is what is going to the president, and if you do reconciliation, most of what we're concerned about in terms of setting up a process to cover all Americans through health exchange with subsidies, with the expansion of Medicaid, so that something like 96, 98% of Americans would be covered. That would all be in there. And you would have the competition with the health exchange to bring costs down so that you wouldn't see this continual rise every year. We're talking about 20-30% increase in premiums that are being announced. So that's what the American people want to see, a bill that basically puts a stop to those large increases every year, that covers most Americans, and that eliminates discriminatory practices. You can't get insurance because of a pre-existing health condition, for example.